Hi, I'm Dr. Evan Matthews. I'm here to do part 3 of the exercise training section. In this part, we're going to be talking about training for anaerobic performance, and we're talking a lot about resistance training and those sorts of things. In part 2, we talked about aerobic training and a lot with sort of endurance type athletes and those sorts of training principles. And then in part 1 of this series, we talked a bunch about just sort of generic overview of exercise training and some principles you need to understand that are going to affect all types of exercise training. All right, so let's get right to this. Anaerobic power is going to be your ability to produce energy using energy systems that don't use oxygen. All right, so aerobic would require oxygen, anaerobic is without oxygen. So maximal anaerobic power is your ability to produce as much ATP, so as much energy as possible, again, through those anaerobic pathways. And so there are different tests that can be done that will assess anaerobic power. And the difficult thing with assessing anaerobic power is each of the different pathways needs to really be assessed separately to get a good idea of how it's functioning. A very common test for doing this would be the Wingate anaerobic test. So this is getting on an exercise ergometer, so an exercise bike, and going as fast and as hard as you can for 30 seconds, and then counting revolutions and calculating the work rate that the individual is able to do and how it sort of deteriorates as they progress through that 30 seconds. So that's a very common anaerobic power test, but there's lots of them out there. Again, you really should test them using the test that emphasizes the anaerobic pathway that they need for their sport. Let's go ahead and spend a minute here talking about some resistance training definitions that we just need to all be conversant on in order to really understand some of the things that are kind of come up in the rest of this lecture. So muscular strength is your ability to produce a lot of force with a particular movement. So it's oftentimes measured with a 1 repetition maximum or a 1 RM. So this is how much you can move a certain amount of weight through a certain exercise for a single repetition or a single contraction. So how much can you move with a single repetition of a bench press or a single repetition of a squat? That is your 1 repetition maximum. And again, that is a measurement of muscular strength. You can also do multiple RMs, so I have just 2 sort of number signs here. It can be various numbers, so it can be a 5 RM, it can be a 10 RM, it can be a 6 RM, it can be a 20 RM, it can be whatever number of repetitions you want. And depending on how many repetitions, if you're looking at muscular strength, you probably don't want to go beyond about 10 or so. Muscular endurance is your ability to repetitively contract a muscle. So this can be either for a single contraction for a long period of time, think like a wall sit or a plank or something like that. Or it can be repeated concentric and eccentric contractions, which is probably more common when measuring muscular endurance. So think of like a maximum push-up test or a maximum bench press test where you see how many repetitions you can do. Typically, if you're looking to measure muscular endurance, you need a test where they can do at least 15 to 20 repetitions. If they're not able to do at least that many, you're really pushing more towards muscular strength than you are muscular endurance, and it's probably not a good test for that individual. The last definition on this slide I want to cover is muscular power. Muscular power is kind of like muscular strength, where it's usually done with few repetitions. However, the difference is muscular power requires you to also move quickly. So for strength, you can move as slow as you want. If you can complete the rep, that's how strong you are. Muscular power, you need to move very quickly. So oftentimes people use the Olympic lifts in order to test muscular power. There are other tests out there too. One of the best tests for this would be to use an isokinetic machine, but those are very expensive, and you're really only going to see those in research facilities and in sort of PT clinics and places like that. You're not going to see it in most gyms just because isokinetic machines, again, are very expensive and hard to use as well. They require some technical skill. So those are some basic definitions that we need to understand in order to understand resistance training. Oftentimes you're going to see people debating whether or not free weights or machine weights are better, and typically the more trained a person is, the more they tend to prefer free weights. It's a little more flexible, which is one of the pros to it. However, there are lots of cons to free weights. So free weights are only going to really tax your muscle at what we call the sticking point, so the most difficult movement parts of the movement. So if you're looking at like a bench press or a dumbbell bench press, like what we're seeing here, the middle of the range is pretty easy. So you're not really pushing yourself there. If you took a weight that you could only move through the middle of the range, you wouldn't be able to do the repetition because you wouldn't be able to do the bottom of the range. You wouldn't be able to do the top of the range, which are the two sticking points for a bench press. Some other things that you need to keep in mind with free weights is that you require yourself to recruit supporting and stabilizing muscles. So these are the muscles that hold you still and allow other muscles to sort of pull on your spine or whatever else in order to do the movement. And so you are going to work additional muscles doing free weights, which is a good thing typically. Sometimes though, you don't want to do that specifically if somebody has an injury, or if they're really trying to focus on a single muscle group, then maybe this isn't such a good thing. Free weights oftentimes require you to be skilled with the weights and know how to do the movements. It also often requires a spotter, somebody that can be there to prevent the weight from landing on you or to help you move the weight if you're not able to move it on your own after fatiguing after several repetitions or whatever. So it can require a little more people and a little more time in order to get good at free weights so that you can do it safely. So they're oftentimes not good for beginner people who are new to resistance training. Because though that's a free weight and almost limitless movement patterns, they are highly versatile and you can do a lot with them, which is one of the best things about free weight. Most modern machine weights have these cams, so these pulleys that are not a circle. Right? They're oblong shaped. They're shaped in such a way where you have what we call variable resistance. So the resistance is going to change depending on where you are throughout the movement, and so it can make it a more continuous level of effort than what you would do if you were doing some sort of free weight version of the same exercise. And so this cam here changes the mechanical advantages and disadvantages of the machine, allowing you to, if it's designed properly and set up properly to your body size, allowing your resistance to vary in a way where it's a more continual effort throughout the repetition, which is a good thing. Machine weights are oftentimes safer, easier, they're more stable. So again, they're better for novices and beginners because it's the weight is in its track. It's only going to move in one way. It's not going to fall in one way or another the way a free weight can accidentally fall or be let go of. And so it's just safer, and it keeps your form the way it should, which is good for people who don't quite have that skill yet. The downside of machine weights, because the machine does a lot of the stabilization for you, you're not using the supporting and stabilizing muscles quite as much, and so you're only really working the target muscles, which again, sometimes that's what you want to do, but most of the time you want to be working all those stabilizing and supporting muscles too, so you can get a more well-rounded physique and well-rounded fitness level. Either way, if you're doing free weights or machine weights, or ideally a mixture of the two, you're going to get about the same strength gains. So it's not going to be a huge difference either way. So don't stress too much depending on your level of skill or the equipment that you have available. Just do the best you can and you'll probably be just fine. Another type of training that has gotten much more popular in the last 10 to 20 years is plyometric training. So plyometrics is going to be when you have some sort of stretch cycle followed quickly by some sort of contraction, shortening of the muscle. So it's a stretch shortening cycle exercise. So oftentimes you'll see these are going to be something where the person's jumping, they're jumping on and off boxes, they're jumping on and off the floor, whatever. Most plyometric exercises are lower body exercises. There are upper body plyometrics, things like push-ups where you kind of push and land, so you launch yourself off the ground and then you catch yourself and you do it again. That would be a plyometric of the upper body. A lot of medicine ball throws are plyometrics of the upper body as well. So it is possible to do plyometrics that are not lower body, but most of them are. Plyometrics are going to have a very strong eccentric loading pattern, and that's going to then be sort of stored in the muscle. The muscles are going to then contract against that, and the elasticity of the muscle, as long as your muscle is healthy and strong enough, is going to sort of help you lift the weight. You're also going to have your muscle spindle that's going to respond to that initial stretch to help you improve your strength and improve the power that you're going to get out of your muscles and allow you to have a much more powerful movement. So putting these things together here, the elastic component of your muscle and the muscle spindle in your muscle, is going to require for the more powerful movement, it's going to require you to move much more quickly. And again, anytime you're moving quickly and doing high resistance loads, you're doing power training. So plyometrics, again, are always going to be a power training exercise if it's done properly. Plyometrics also probably isn't for the novice or beginner. Let somebody be doing exercise for at least a month or two before they get to trying plyometrics. It's more of an intermediate level skill. What happens when you begin resistance training? Okay, so we have here time on the x-axis, and it's not a continuous scale. As you can see, we have a break here going on until infinity, and then we have the improvements in various measurements here. So we have the neural control of the system, so how your nervous system controls your muscles. In other words, we have hypertrophy, so how large the muscles are, and we have strength, so how much you can move in a single repetition, essentially. So your strength is going to go up from day one. It's going to go up really quickly at the beginning, and it's going to take a while. Eventually, it's probably going to plateau. And if you try to explain what's happening during this improvement in strength in the first 3 weeks or so, from the day one all the way through 3 weeks, you're going to have little to no hypertrophy in somebody who's beginning a beginner to resistance training. So notice that the hypertrophy line, this purple line, doesn't even start until 3 weeks. The neural control is what's going to be driving this strength. And what do I mean by neural adaptation? So here's a short list of these things that change when you start to do resistance training, that change your nervous system. So we have an increase in the recruitment of motor units. In other words, how many neurons are actually being activated, sending a signal to the muscle cells to activate as well. We have an increase in the motor neuron firing rate. So the neurons fire more frequently, which is going to increase the strength and the power development. We have an increased synchronization of the different motor units. So when you first start out, you're kind of awkward, you're clumsy, you're not very coordinated, and so basically your motor units become more synchronized, you become more coordinated, so you can lift more weight and you become stronger that way. And the last one here, you have less neural inhibition. So inhibition means something that stops it or inhibits the neurons from firing. So less neural inhibition means the neurons are going to fire more often. Again, higher frequency of firing and more motor units are going to fire. All these things are going to increase how many muscle fibers are active all at the same time, which is going to increase your strength. First 3 weeks, all neural adaptations. From 3 weeks to 20 weeks, it's still mostly neural adaptations, but you are getting a little bit of hypertrophy. You're finally starting to get a little bit of an increase in muscle size. Once you get beyond about 20 weeks, your neural adaptations tend to plateau. So most of the improvements in strength that are going to happen beyond 20 weeks are going to be driven by hypertrophy. All right, so after 20 weeks is really where hypertrophy becomes the dominant mechanism for improving strength. So how do we increase muscle size? There's a definition here I just want to go over. It's not a major player here. It's called hyperplasia. So hyperplasia is the increase of the number of muscle cells in your given muscle. So it would be going from 10 muscle cells to 12 muscle cells. Just to give a very simplistic example, that would be hyperplasia. Most people believe now that hyperplasia does happen in humans, but it's a very, very small factor. So only about 5 to 10% of muscle growth is thought to be hyperplasia, and some people think it's even lower than that. And typically hyperplasia is only going to happen when you have some sort of muscle damage that's beyond just normal training damage, so like a muscle injury or something like that. Then you'll have hyperplasia. But most of the time, hyperplasia, again, it's such a small factor that it's kind of negligible and we don't have to think about it much more. Muscle hypertrophy is what we talked about in the last slide, and that's what primarily is going to cause an increase in muscle size. And so this is kind of a fake dramatization of this, but essentially what happens is you have your muscle fibers. Each one of these circles is a muscle fiber, and you can see these purple dots are the nuclei, and then the muscle cells themselves just swell and get larger. And so this would be an extreme example. Again, this is just an artificial example here though of hypertrophy. So you can see a muscle cell that was very small before can now be much larger now. So that is hypertrophy. Again, the muscle cells you have getting bigger, not you getting more muscle cells. That was hyperplasia. Hypertrophy is going to happen in both type 1 and type 2 muscle fibers, so the slow twitch and the fast twitch muscle fibers, but it's going to happen to a greater extent in your type 2 muscle fibers. You're going to get more myofibrils, which are the actual muscle proteins that do the contraction, so more actin, more myosin filaments. You're going to get more sarcomeres in the muscle, and you're going to get a little bit more connective tissue just to kind of hold it all together. And so all these things increasing is what causes the hypertrophy, and together all of those are going to also improve the strength of the muscle cell. If we stop training or something happens to the muscle, say we get sick for a long period of time, a lot of cancer patients, that sort of thing, you can go through muscle atrophy. And so muscle atrophy would be sort of the reverse of this, so going from large hypertrophied muscle fibers to smaller muscle fibers. And so muscle atrophy is a decrease in muscle size, and again, associated with detraining or oftentimes illnesses. And so muscle atrophy, generally speaking, is a negative thing. Another term that we just need to cover here is called transient hypertrophy, or the lay term for this would be the muscle pump. And this is when you do a resistance training set. Usually it's going to be a higher rep set, and you get a lot of blood flow to the muscles, and the muscles kind of swell up and you feel really big. That is what is referred to as transient hypertrophy. It's not real hypertrophy. Yes, your muscles feel bigger, but it's just an increase of sort of fluids trapped in the muscle cells. It's not an increase in protein of the muscle cells. So it happens immediately after exercise. It's edema, so it's swelling, it's fluid collection, and it disappears within minutes to hours after the exercise bout is completed. So transient hypertrophy is not real hypertrophy. So continuing to talk about detraining, when we were talking about atrophy in the last slide, what's going to cause detraining? So first of all, it's important to note that detraining from resistance type exercise is much slower than detraining from aerobic exercise. So if you stopped training aerobically, you would see huge decreases in exercise performance, aerobic exercise performance, within a week or two. If you stop resistance training, you're going to see a little bit of a decrease in a week or two, but it takes a lot longer than that. So if you want to see how long, about 30 weeks of detraining is going to show about a 31% decrease in resistance training performance. So it does take quite a while, again, especially considering how quickly aerobic training can detrain. Same concept though as detraining for aerobic training, which we covered in part 2 of this series. So whatever the first mechanism to train is going to be the first mechanism to detrain. So it's basically the mechanism that is most adaptable. So with resistance training, the first mechanism that trained was your neural adaptations. So the first mechanism that is going to detrain is also going to be your neural adaptation to doing the resistance exercise. So the nervous system is going to be primarily what gets worse in the first weeks or so of detraining. Eventually, if you detrain long enough though, you're going to have a decrease in the actual muscle fiber size. And so remember that type 2 muscle fibers are going to have the most hypertrophy, but they're also going to have the most atrophy after you stop training. So type 1 muscle fibers will shrink about 2% with a long period of detraining. Type 2A is about 10%, type 2X is around 14%. So again, the type 2 fibers do atrophy more than type 1 fibers, but they also hypertrophy more than the type 1 fibers. Just like with aerobic training, if you go through a period of detraining and then you start retraining again, you're going to see that you improve your abilities quicker the second time than what you did the first time. And that's basically that you still have some of the structure there if you didn't detrain for too long. Now, if you stop training for 30 years, you're basically a brand new person to resistance training. But if you stop training for a couple months and then you start training again, you haven't lost everything. Some of those structures are still there. They just need to be sort of built back up again. One good thing about resistance training, again, is it's a slower detraining process than aerobic training. So a lot of times people will take advantage of this if the resistance training isn't that important to them, or if they're getting prepared for a major athletic event, and they'll greatly reduce their volume and their intensity of their resistance training and go into what's called a maintenance phase. And so if you go into a maintenance phase, you can reduce your training for up to 12 weeks without having a real significant loss in your strength and power. So resistance training, again, much easier to sort of hold on to those training adaptations than aerobic training. So let's get away from the resistance training for a minute here and just talk about anaerobic training in general. So when you're trying to improve your anaerobic capacity, remember, as I talked about at the very beginning, you need to test the specific energy systems, but you also need to train the specific energy systems. So the idea of training specificity again comes into play here. So if you're doing 5 to 10 second intervals, this is something that you can think of like a 30-yard dash that a football player might train with. This is something that's going to primarily be working the ATP phosphocreatine system depicted here. So you can probably do 10-second interval with 30 to 60 second of rest, and then go back to do another 10-second interval. And again, you're going to make yourself better at doing exercise in that sort of 10 to 20 second range, because you're working the phosphocreatine system, and that is where it is best at. If you are an athlete that requires a longer period of activity, say like a basketball player, where you might have 20 to 60 seconds of high intensity exercise, then the game kind of slows down a little bit, and then you get a little sort of rest in there, and then you get another high intensity part of the game. Then you're going to probably need more of the glycolytic system, so you're going to have to work your glycolysis and get that to be a better, more well-trained system. And so your interval training is going to need to be 20 to 60 seconds long in your high intensity bouts, and your rest intervals can be at least that long, but up to several minutes. You maybe do 60 seconds on, 5 minutes off to really give your body a chance to replenish as much of the glucose in the blood or in the glucose in the muscle as possible, and also replenish the phosphocreatine in the muscle. And then you go back in, you do another 60-second interval, and then a 5-minute rest. With this kind of training, because you're working glycolysis, which is what produces lactic acid, it's going to be very demanding. It's going to have a lot of muscle burning, a lot of fatigue sensations, and it's going to be very, very challenging. And you're not going to want to do this every single day. You're going to want to probably alternate hard and light days if you're doing training for the glycolytic pathway. So kind of a hot topic in the field of physiology and the field of exercise is how women and men compare to each other. So I just want to spend a minute talking about this regarding resistance training. All right, so if you look at untrained males and untrained females, there's usually a pretty large difference between the two. One of the reasons for this is that untrained males actually are slightly more trained than untrained females in general. That's not everybody, obviously. We're making a great assumption when we say this. So most men tend to be a little bit more physically active than women. Women are improving their physical activity and have been over several decades, but they still haven't quite gotten to be as active in their daily lives as what most men are. And because of this, there's a big difference between untrained men and untrained women. So if we look at untrained individuals, men tend to be about 50% stronger in their upper body and about 30% stronger in their lower body than what women are. Because men tend to use their upper body a little bit more, where everybody, men and women, use their lower body a lot. So you can see that this is a little bit of the lack of activity that oftentimes women have that's driving this upper body to be worse than what the lower body is. All right, so generally speaking, if we want to do a cross-sectional type research study comparing men to women for strength, we really need to make sure we're comparing people of equal physical activity levels and equal training status. So most of the time, it's going to be a lot more fair comparing men to women if you're looking at trained individuals versus untrained, because again, untrained men tend to be a little bit more physically active than untrained women. We start comparing men to women. The stereotype is that men are so much stronger than women, and typically men are stronger than women, but it's not something inherent about being a man that makes men stronger. What is different is men tend to have larger muscles because they have more testosterone, and testosterone builds muscle up. So if you have more muscle, so a greater cross-sectional area of your muscle, you're going to be stronger. So if we look at this relationship here, we have both men and women on this line, each dot being a single individual. You notice that they're all going to fall somewhere along this line. So what really drives your strength is not whether you're a man or a woman, it's how much muscle you have. So if you look at the cross-sectional area of the muscle a larger muscle is going to be stronger, a smaller muscle is going to be weaker, and then everybody else just kind of falls somewhere in between. So you see that there are some women here that are out competing men, but it's because they have larger muscles than the male counterparts. So again, it's muscle size, not sex, that's going to determine the strength of the individual. Now, if we look at training adaptation, eventually, if you have two people, one's a man, one's a woman, and you train them for a really long period of time, eventually the man probably is going to become stronger than the female. The reason for this being, again, testosterone. Men have a lot of testosterone, women don't, and testosterone helps promote muscle growth. So if you have a man and a woman training, and they're equal in every way, and you do just look at the first few weeks of training, they're going to improve about the same amount. The reason they're going to improve about the same amount is because the man is going to not have that benefit of having hypertrophy yet, because remember, hypertrophy doesn't usually start until at least 3 weeks, and it really doesn't become dominant as the source of strength improvements until after 20 weeks. So for the first month or so, both men and women are going to be relying primarily on nervous system adaptations to improve their strength, and that's not going to be altered by whether or not they have testosterone. So the improvements early on in a training regimen are going to be about the same between men and women, and so it's not until later that those differences are going to come out. Another hot topic when looking at resistance training is looking at aging. So generally speaking, people get weaker as they age, and this decline is going to be greater after the age of 50. All right, so normal aging is going to result in loss of motor units. So a motor unit, remember, is a single motor neuron in all the muscle cells it innervates. Normal aging, you're also going to see a lot of atrophy, primarily of the type 2 muscle fibers, not so much the type 1 muscle fibers. And the reason for this is, as we age, we hopefully continue to be reasonably active. We still walk around, we still have to go through our activities of daily living, lifting the garbage out and things like that. And that's not going to use a lot of the type 2 muscle fibers. It's going to be more type 1 muscle fiber driven. And so our type 1 muscle fibers are going to be better maintained with age than our type 2 muscle fibers. If somebody trains throughout their lifetime, they're going to maintain more of the type 2 muscle fibers than if somebody doesn't train. So that was all normal aging. We also have some people experience abnormal aging when it comes to their muscles, and we call it sarcopenia when they have an excessive loss of muscle mass when they age. And so this is going to affect both the type 1 and type 2 muscle fibers. And this is something that usually happens when the person develops some sort of chronic disease that's going to impact their body's ability to maintain muscle mass. So maybe they're going to get muscle wasting. So maybe they don't retain nutrients as well, or maybe they don't get as much oxygen around the body as they need to, or whatever it is. If you have something that's going to decrease your body's ability to maintain the muscle fibers, they're going to atrophy and they're going to go away and they're going to waste. And that is called sarcopenia when it happens, again, to an excessive level. Think of like a frail old person. They went through sarcopenia. The good news here is, although people tend to lose muscle fibers and weaken and get smaller muscles with age, we can still resistance train older individuals, even people who've already atrophied quite a bit. And people who start resistance training can prevent further atrophy, and they can actually hypertrophy and get strength gains and get more like their younger version of themselves. They might not ever get all the way back to that, but they can improve. So aging can be the negative effects of aging can be partially stopped by resistance training. And with resistance training, we also have some other positive benefits. So people have a better ability to get around their activities of daily living. They have better balance, so they don't fall as much, which is good. So a lot of people fall and they break their hip or something, and then they have to go through surgery, and they have complications from that surgery, and all kinds of bad things can happen from that. And so reducing fall risk is going to be a really impactful thing for maintaining the health of an older individual. Let's switch gears for a moment and talk about resistance training and how we can alter resistance training so that we can focus on one aspect or another of muscular fitness. So one of the main ways that we can focus on something like muscular strength versus muscular endurance or hypertrophy is by altering the repetitions that we do in each set of our exercises. So generally speaking, we're going to do our repetitions. Let's say we're doing 10 repetitions. We want by the 10th repetition to be fatigued to the point where we can't do the 11th repetition. Or at least we want to get to the point of volitional fatigue, which is basically where we kind of subjectively say, okay, maybe I could do one more, but no more than that. That would be volitional fatigue, where real fatigue is where you actually can't lift the weight and somebody has to come and pull the weight off you. So generally speaking, we go to volitional fatigue. But so if you want to work on, say, hypertrophy, you would pick a weight where you would hit volitional fatigue somewhere between about 6 and say 12 repetitions if you look through this sort of green area here. So that's where you're going to be primarily working hypertrophy. If you're talking about muscular strength, now you're talking 1 to about 6 repetitions as the primary area where you're going to improve muscular strength. Muscular power, pretty similar, about 1 to 5 repetitions, but now they're faster repetitions than what they were for strength. And for muscular endurance, you're talking beyond 12 repetitions, so 13, 14, 15, and beyond, when you're going to focus primarily on muscular endurance. So again, the repetitions that you do is going to be what determines the muscular fitness outcome that's going to come out of the resistance training that you do. So most of the time, we're going to be doing between 2 and 10 sets per muscle group, okay? 2 sets would be the low end that most people can probably get away with and still see some decent improvements. 10 sets per muscle group is quite a bit. If you go beyond that, the chances are you're probably going to end up getting injured or just going into more of like an aerobic type mode of training where you're not really doing what you're trying to train with resistance training. You're not training your anaerobic systems or your muscle fibers quite so much. So it's not really beneficial to go beyond 10 reps or 10 sets. But again, 2 to 10 sets, depending on the fitness level of the person, is where the sweet spot is. So the more fit they are, the more sets they can do. The less fit they are, the fewer sets they should be doing. All right, so you can get by with as little as 1 set for somebody who's a novice, but you really need to progress them to 2, 3, 4 sets at least. And that's, again, per muscle group. That's not talking per exercise. So if you're doing bench press and you're doing tricep extensions, both of those exercises work your triceps. So if you're doing 4 sets of bench press and 4 sets of tricep extensions, you just did 8 sets of triceps work. So you can only do another 2 sets before you start running the risk of injury and sort of not getting what you really want out of your training. So it's cumulative number of sets across all the exercises you do, not just per exercise. All right, so talking about training frequency now. If you're doing total body routines, meaning you work every major muscle group in a single workout session, 2 to 4 days per week is what you probably should be shooting for. Lower for somebody who is lower fit, newer, or who this just isn't a focus of their training. Higher for somebody who's higher fit. The goal here is basically never to train a muscle group on a back-to-back day. So if you're doing total body routines, that means you can train on Monday, you can't train on Tuesday, at least not resistance training. You can train again on Wednesday, not on Thursday, and train again on Friday, and so on and so forth. You have to take a day off in between. You can also do what's called a split routine. A split routine is where you split the body into multiple days. So maybe one day can be legs, another day can be upper body, one day can be push exercises, another day can be pull exercises, whatever it is. So there's different ways to split up the body. So if you're doing a split routine, you can you can do resistance training almost every day, because again, the goal is to not train the same muscle group 2 days in a row. So if you're doing, let's say, an upper body and a lower body split, you can train the lower body on Monday, the upper body on Tuesday, so that you just went 2 days in a row, but different muscle groups. And then you come back to the lower body on Wednesday, back to the upper body on Thursday, and you can do it like that. And so you can increase to 4 to 6 days per week if you do a split routine without ever training the same muscle group 2 days in a row. Anytime you're figuring out your training routine and planning it out, make sure you think about specificity. So train the way you need to for your competition if you're an athlete, or train the way you want to for whatever it is that in your life that you care about if you're a non-athlete. So that means the same muscle groups, the same speed of movement, the same energy systems, all that. Specificity of training is super important. Generally speaking, if you're doing more repetitions, you're going to be using a lower level of resistance, and you can probably use shorter rest periods. If you're doing Low repetitions, that means you're using more resistance, so more strength and power involved, and you need longer rest periods in order to hit the next set with the same level of intensity that you hit the first set with. So low repetition, high resistance, high rest, high repetition, low resistance, low rest. That's generally speaking what people do. And that's going to keep you working the same muscular component of fitness that you're trying to work on, and also decrease the risk of fatigue or maybe even injury. Every resistance training workout should have concentric, eccentric, and some isometric contractions built into it. And oftentimes, if you're working out hard enough, you're doing exercises that put you through a range of motion, that's going to have concentric and eccentric in it. And towards the end of the set, when you start to fail, you might run into some isometric contractions. So you do have all three of these built in sort of naturally in a high intensity resistance training routine. So some other things to keep in mind here is your exercise order is important. So power movements should be done before strength movements because they require more speed and more rested muscles in order to do appropriately. Large muscle mass exercises should be done before small muscle mass exercises for the same reason. Multiple joint exercises should be done before single joint exercises, again for the same reason. It's more exhausting and it requires more effort, more energy, and more rested muscles to do it appropriately. And the last one is kind of the easy one. High intensity exercises should be done before low intensity exercises for all the same reasons I just mentioned. All right, so generally speaking, a novice to intermediate lifter can get by with 2 to 3 minutes of rest between a set, from one set to the next, where advanced lifters can shorten that to 1 to 2 minutes between sets. Now, this is going to be altered, though, based on the goals that you have. So I already mentioned, if you're doing muscular power and strength, you typically want longer rest. Muscular endurance, muscular hypertrophy, typically shorter rest periods. So these are just sort of general recommendations that you're going to see in a lot of textbooks, but they aren't necessarily great for athletic pursuits. You should get a more specific recommendation for rest if you're doing it for athletic purposes. I talked a little bit about periodization in section 1 of this series on exercise training, but let's talk a little bit more about it. So periodization is the systematic variation of volume and intensity of your exercise over time so that you can focus on different aspects of muscular fitness. So again, muscular strength, power, whatever it is. And so typically what you're going to do is you're going to split up your periodization into macro cycles, which would be typically a year or a season of training. Mesocycles, which would be several weeks, oftentimes it's a month or 2 months, and then microcycles, which is typically days to about a week. And usually you're going to see people say 1 week is one mesocycle or one microcycle. So if you are doing a linear periodization program, which is when you do one aspect of muscular fitness and that's all you really focus on, and you switch to another one in a month or two, and then you switch to another one a month or two after that, that's a linear periodization program where, again, it's really focused on one aspect at a time. So typically they'll do a mesocycle of, say, muscular endurance first, then you'll do a mesocycle of muscular hypertrophy, then you'll do a mesocycle of muscular strength, and then finally a mesocycle of muscular power. And that's sort of a generic continuum that most people use. You can mix it up with different ways of doing that. You don't have to do it in that same order, especially with somebody who's already been training for a while, already at least intermediate or advanced level. They can do it in different orders. But novice people, you probably want to do that same order I just listed. If you do this, so if you do a periodization program, by the end of the whole program, typically that's when you have some sort of athletic event that's super important, a championship or something. By the end of the program, that person is going to be much more fit than if you just did one exercise routine for the entire year. All right, so if you don't vary it, you don't do any sort of periodization, you're probably going to get somebody who plateaus really quickly and just stagnates and doesn't improve after that. So periodization helps prevent that stagnation, and it helps you build upon different aspects of muscular fitness. So at the end of the season, you're at your best. So linear periodization is sort of the traditional model, but non-linear periodization, which I'll talk about now, is the less traditional model and what more and more people are starting to experiment and try out. And there's some benefits to it. They both are going to give you pretty similar gains in strength at the end of your training cycle. So at the end of your full year, your macro cycle training year, you're going to have about the same results. So pick either one, you'll probably get to the same spot. The difference is, so with linear periodization, each mesocycle, you only do whatever muscular fitness component you're focused on at that moment. With non-linear periodization, on day 1 of your week, so on Monday, maybe you'll do high repetitions. On day 2 of your week, so maybe that's Wednesday, maybe you'll do low repetitions, more power, more strength type exercises. So you're going to mix up the components of muscular fitness within a single week rather than only doing one component of muscular fitness for a month or two straight and then switching. You're still probably going to pick one of those to be your goal for that particular mesocycle. So let's say my goal is muscular power. So on Monday, when I'm doing muscular power, that's going to be the day that I pick as my really hard day, and then I'll probably do another muscular power day on maybe Thursday or something. That's going to be another really hard day. But on the other days throughout the week where I'm doing resistance training and I'm doing muscular endurance or muscular hypertrophy or something like that, those are going to be my easy days where I'm going to allow myself to work a little easier, not push myself quite so hard, and so I can really push on those muscular power days. And so that's the way you can still do focus on one aspect of fitness at a time, but you can mix in the other aspects of muscular fitness. And the benefit to this is that you don't switch so much. So with the linear periodization programs, you're really good at muscular endurance, and then you switch to hypertrophy, and your muscular endurance kind of wanes a little bit while your muscular hypertrophy is getting better. It doesn't go all the way back down to before you train, but it goes down a little bit, and then you switch again, and then you keep having a little bit of a detraining of the different aspects of muscular fitness because you're only doing one at a time for long extended periods, a month or two. With the non-linear periodization, where you're mixing it all into a single week, even though you're focusing on one per mesocycle, you're still doing the other ones. So you're still maintaining them a little bit better. And so people who need to have a high level of muscular fitness, of all types of muscular fitness all the time, are probably better off with a non-linear periodization program. So a lot of athletes fall in this category, but also let's think of more of the tactical people in the world. So military people, firefighters, police officers, they need to be fit all the time. There's not like a single day at the end of their season where they're training for this one event. They need to be fit all the time and have all aspects of muscular fitness fit all the time. So linear periodization is probably much better for them. If you want to learn a little bit more about the differences between linear and non-linear periodization, because we're only barely touching on it here, you can scan this QR code here or type in the link there, and there's a nice article that's going to go over these. It's a review article on the differences and the benefits of each. We're going to switch gears just for a few minutes here and talk about training to improve flexibility, and that will round out this series on exercise training. All right, so when you're trying to improve flexibility, you need to do stretches. So stretches help to improve flexibility and range of motion, and they can lead to greater efficiency of movement. So you're not going to be really pushing your muscles in order to extend the end of range of motion. It's just going to be a little more fluid, which helps with exercise performance. Everybody's told all the time about how you need to stretch in order to decrease the risk of injury. And if you are not flexible enough, that's true. So if you're not flexible enough for the activities you're trying to perform during your exercise, your daily routines, then improving your flexibility will decrease your injury risk. However, if you're flexible enough, then improving your flexibility more is not going to decrease your injury risk. But let's say you want to improve your flexibility. How do you do it? So we have different types of stretching. Static stretching was kind of the generic that most people do. And this is when you just go to the end of the range of motion and you hold the stretch. And you usually do this for 10 to 30 seconds per stretch. And you do repetitions that are 2 to 6 times per exercise. So let's say you're doing a hamstring stretch and you hold it for 10 seconds, you would want to do 6 of those repetitions of the hamstring stretch that are 10 seconds apiece, because you're trying to total 1 minute of total stretching time. If you're doing 30-second stretches, you only need to do 2 stretches of the hamstring stretch in order to get to your 1 minute of total stretching time for the hamstring. So however you want to mix these up, it doesn't really matter. For most people, going beyond 30 seconds isn't going to be beneficial because the training adaptations start to decrease after that. There is some evidence to suggest that older individuals going beyond 30 seconds might be beneficial to them, but for most people, not so much. Going less than 10 seconds per stretch is going to decrease the output you get, so decrease how much flexibility you get. Static stretching is really good because it's really controlled and there's a low risk of injury with it. But keep in mind that with static stretching, it can impair your athletic performance for the period of an hour to 2 hours or so after the static stretching. So it's probably not something you want to do during your warm-up. It's something you should keep for more during the cool-down section of your workout. All right, so dynamic stretching, this is moving your limb through a full range of motion in a nice, slow, controlled fashion. This is going to be what you should be doing during the warm-up. All right, so it's not going to get you to the end of the range of motion and holding that end of the range of motion, which means it's not going to be activating the Golgi tendon organ, and it's not going to decrease your exercise performance after you finish it. All right, so again, static stretching is really good for the cool down. Dynamic stretching is really good for the warm-up. Ballistic stretching is a type of stretching that you should never do. You still see people doing it, still see a lot of athletes and coaches doing it. Ballistic stretching is when you sort of do a fast bouncing movement to your stretch and you're going all the way to the end of the range of motion and you're really kind of bouncing at the end and you're pushing yourself really hard towards the end of the range of motion. You're just kind of bouncing repeatedly, typically. And the reason why it's not recommended is that it's got a really high risk of injury, much higher than the other types of stretching. So if you can get the same benefits out of the other types of stretching with lower injury risk, why do ballistic stretching? And there's really no benefit to it, so that's why it's not recommended anymore. The last type of stretch that I want to quickly mention here is something called proprioceptive neuromuscular facilitation, or PNF stretching. And this is kind of like static stretching, but it involves 2 static stretches with a contraction in between. So you do a stretch, you do either an isometric or concentric contraction of the same muscle that's being stretched, and that will engage the Golgi tendon organ, causing an inhibition of the muscle and relaxing it further. And then you do a second stretch immediately after that, basically a second static stretch immediately after that, and that stretch should be able to go a little bit further. So if you want to learn a little bit more about PNF stretching, you can go and scan this QR code here or type in the link here, and it'll show you a video how to do a hamstring PNF stretch. Typically this is something that's done with partners, and it's more of an advanced stretching technique, so not something meant for beginners or novice people to exercise. This is the end of the exercise training section of this course. So if you have any questions, you can put those in the comment section below and I can try to get back to you. Otherwise, please come back and watch another video. Thanks.